Ladies and gentlemen, thank you very much for joining us, and good afternoon to you. My name is Will Alstein. I'm the Commercial Director at YouGov, and I'm delighted to be joined today by, in the first instance, Gavin Ellison, who is our Director of Public Services and Not-for-Profit, and Sarah P. Jones, a doctoral researcher from Imperial College, London. We're taking a bit of a break from our usual COVID-19 webinar series and bringing you a special episode here with a sneak preview of not only the data that scientists are using, but Sarah is on the line to give a more thorough explanation of the way that that data is being used, the models that scientists are looking at. And there's been a lot of talk recently in the UK, especially about R, and Sarah is going to unpack exactly what R is for us. Just a couple of housekeeping things, if I may, to start with. There is a chat function on this Zoom application, and we would love you to ask us questions. We've left time at the end of this webinar, so please do jot them down as we go, and we will come back to you and get through as many of them as we possibly can. Right, I'm going to, in terms of our agenda, I'm going to open. I'm going to talk very briefly about the types of data that we have on offer, just to make sure that there isn't any confusion about what we are talking about today. Gavin is then going to come in and talk about our behavioural data, what it's saying, and he's also going to bring out some of the key benchmarks from across the world that will be really interesting to look at. And then to bring us home, it's Sarah talking about the science, so the models and some of the briefs behind that. So without further ado, let's get into the content. When the pandemic broke, YouGov's CEO was very clear. Stefan said to everyone across the business that our mission and our priority right now is about serving the public good. And what he meant by that was giving everybody across the world the opportunity to contribute to the discussion and to have their voice heard, and aggregating all of that data in a way that was usable and delivering it to public health organizations and policymakers that can make a difference when fighting this pandemic. And it's that element, that last element of talking to policymakers and public health organizations that we're going to be exploring more of today. So YouGov has actually created 3 types of data as a result of COVID-19. We have, to start with, if I start on the far right of this chart, our consumer monitor. So this is designed for our clients and covers a whole range of topics, from people's levels of concern, their change in consumer behavior in terms of spend or media consumption. It also looks at their future habits, so things that have been learned as a result of COVID-19 and are likely to be sticky in the future. For example, taking up more online services or click and collect type services, or reducing their use of cash. We also cover things around employment and economic confidence and outlook. So it's designed to be a commercial data set, useful to brands and media agencies, and is available on subscription. We then have our public data. So this is data that YouGov is putting out into the public domain via our website. There are interactive charts, and it covers things around fear, support for government, and it brings some headlines from our consumer monitor. But the bit that we're going to be talking about today is our behavioural data. Now, this is specifically designed for public health organisations and policymakers. Gavin will go through the detail of what that covers and will bring the results to life for you. But it's also a first for YouGov, because we've, for the first time, made this data open source. So the respondent level data in anonymous format is available on GitHub, and through our partnership with Imperial is available in dashboard form powered by Tableau on coviddatahub.com. What I will do at the end of this webinar is I will put all of the links to those things on screen. But if you do have any, if you do want to take them down, please do. And we'll also circulate a copy of this deck afterwards so that you have a physical copy of those links. I talked about our relationship with Imperial College London, and we have Sarah Jones on the line with us today. YouGov has partnered with the Institute of Global Health Innovation at Imperial College London. And what we are doing in collaboration together is blending our complementary skill sets. The Institute of Global Health Innovation is a world-leading department in and around the science of infectious disease and in its field. YouGov has the ability to talk to and open a dialogue with thousands and thousands of consumers across the world and aggregate their data in a way that can be useful. And it is those two skill sets that we are bringing together to deliver an understanding to policymakers and health organizations what their audience, i.e. the population, is thinking and how they can be ethically nudged into taking the right action at the right time. So if that's the data that we're talking about, I'm now going to hand over to Gavin, who's going to walk us through some of the headlines from the behavioural data. Gavin.
Thanks, Will, and good afternoon to everyone. Yep, as Will says, I'm going to take you through both an explanation of what the study is and some of the selected highlights from it. So the subject matter that we are covering in this study is very broad, but it covers a number of things of great interest to policymakers and academics. We cover the issues around symptoms that have been experienced, a number of aspects relating to isolation, so someone's ability to isolate, their willingness to do so if it was necessary. We ask a number of questions that are captured in a numeric way. For example, asking people how often they left the home in the previous day, how many times they washed their hands, how many people they are coming into contact with, both inside and outside the home on a typical day. And that's really important to have that numerical level of data per respondent, because that's the kind of thing that is very useful for modelling purposes. We ask a series of questions around avoidance, preventative measures. These can be things like avoiding small gatherings or wearing a face mask. There's around 20 of those that we are following. We've also quite recently added some questions around mental health, where we're using the PHQ-4 system, and the life satisfaction ladder question as well. We've made the study available to local public health organisations and academics to add localised questions just in their country, and that's something that a number of them have taken up, and that includes WHO in country teams. We have forthcoming a new section within the study, which is a deep dive on all things related to masks and face coverings, and a smaller section around vaccinations. And right at the end of these highlights, I'll just give you a taster of what some of those things are. The study that we created spans 29 countries globally, as indicated on this map. It began in late March, and we now actually have around 120,000 responses. across the world. We have been running it every week in 10 countries and every 2 weeks in 19 countries. And every time it's run, there's around 1,000 responses are gathered. Each of the responses we have is date stamped, which is a vital element for tracking the progression of behaviours over time. And we have a number of consistent demographic and contextual questions as outlined there, age and gender, as you might expect, but also really important things for this study, such as whether there are children in the household, how many people are living in the household, and whether the respondent has any sort of pre-existing health conditions. There's a list of around 10 which have been very useful for analysis, things like diabetes or COPD, for example. So going into some of the data now and just picking out some of the questions. I mentioned that some of the questions we ask are done so in a numeric way. So we're asking, how many times did you leave the home yesterday? This is the data for the UK tracked over the period of time since we started running the study. It's a gradual increase in the number of times that people have been leaving the home. As you can see there, I'll probably draw your attention to the blue line, which is second up from the bottom. Just within the last couple of weeks, there's an increase in the number of people leaving the home sort of twice during the course of the day. Generally speaking, though, the average is low. I think it's just below 1 on average. It's a 0.65 among those who are 70 plus, and is the highest for those that are in their 30s, just over 1. And it's higher for men than it is for women. There is more movement outside the home when we sort of benchmark the UK with other countries. There's more movement being seen in places like Germany and South Korea, which are at a different stage in their in exiting the lockdown, and that's reflected in these movement figures. It's actually more that there's actually less movement outside the home in the US than there is in the UK. It's a remarkable level of consistency around leaving the home. So the percentage cut across the regions, from a low where I'm sitting here in Northern Ireland of 35%, up to a high figure which is for Yorkshire of 45% did not leave the home in the previous day. So I mean, obviously important to remember that for the vast majority of the time that we've been running this study and the lockdown has been in place, the lockdown has been, of course, consistent across the UK, with the exception of possibly about a week and a half or so in the more recent past. We're interested in whether people would automatically start to self-isolate if they had started to develop symptoms. The percentage responding to say that yes, they would go and self-isolate is really high in the UK, actually, compared to other countries. Lower, as you can see there, in Germany and South Korea. This could reflect, of course, that they're possible, the fact that they have other kind of measures in place which are increasing levels of confidence, perhaps, in the ability for people to carry on leaving the home during if they were to see any symptoms there. There is a general gradual decline in whether people feel that they would self-isolate if symptoms develop. So this is again the UK. It was actually at its highest point in the first week that the survey was run, right at the end of March, and has been gradually declining since that point. It is higher among women than men, and it's encouragingly higher among those who have health conditions, which is what you would hope to see. The lowest figure is those in London, but it's still high at 85%. Interestingly, we can look at some of this data as to where it is that people are working. So if they're in work, we ask them, are you staying at home to work, or are you leaving the home to work? And if you are leaving the home, what is it that you're actually doing? So you can see that when you cross the question about whether you would isolate with symptoms by what it is that people are actually doing when they're going out of the home to work, you can see there's quite a big difference there. So those who are home working, so 90% of them would go into the self-isolation. There's a really a more concerning lower figure of 69% who are working in public transport and 72% who are working in logistics and other transportation, whose sort of first response to developing symptoms would, their first sort of thoughts around whether they would self-isolate seem to be less certain that they would do so. There's an important separate question which policymakers are very interested in, which is a person's ability to go into self-isolation. Do they have the support structure around them to allow that to happen? Do they sort of have all the things in place that are necessary? When we look at when we ask that question, and sort of try to work out who feels it would be easy or difficult for them to isolate, there are some quite big differences there. So those who don't have children would find it a little bit easier to do so. And with those that do have children in the household, those in say Germany and South Korea actually say that they would find it. Many of them would actually find it difficult to follow the self-isolation rules. And then a follow-up question to that really is, well, if you were in a situation where you were being actually advised and told that you had to go and self-isolate, would you do so? And the kind of the thoughts about compliance with that is generally very strong. You can see here it's a great deal of consistency there, from a low in London of 90% to a high in the east of England of 96. It is higher for women than it is for men, and it is lower for younger people, and it's higher for those who have got pre-existing health conditions there. But generally speaking, it's a very high figure. Another of the numeric questions to poke our noses into is how often are people washing their hands each day? And that's something which does unfortunately show up us men, because we on average would not be washing our hands as much as women do. The averages across the countries are interesting as well, in a selection on the right hand side showing a high in Denmark of 18, slightly lower in Brazil with 14, and the USA and the UK, Mexico and Canada having the exact same average number in 12. Goes down to a low, and the lowest one globally is in China, with just 5 times on the previous day to when they took the survey. Using a face mask or a covering is still a pretty rare behaviour in the UK. Although the extent to which other behaviours such as washing your hands regularly with soap and water is very, very high in the UK. So you can still see the kind of effects of the early messaging from the government way back in March there. Wearing a face mask in the UK is really trailing kind of every other country in the study. Though, to be honest, the very high figures are seen in Thailand, Vietnam, South Korea and China, so always in the 90%. Australia is a lot lower at 25% and is actually much lower than the US and Germany there. And in the UK, it averages out at around 15% at the moment, who are frequently or always wearing a face mask or covering when they leave the home. But it is rising slightly over time. So in this chart, the UK is the pink line. So starting on the 12th of March, we've gone up to 23% now, and the week commencing the 11th of May. You can see that in Italy, the dark blue line at the top, it started high and has gone even higher, up to a 96%. And there's really stark movements in time from in Germany, which is the red line, from 19% all the way up to 82%, and in France from 29% up to 75%. And I mentioned at the beginning that there is a new section that we've added for all 29 of the countries covered by the study, which is a deep dive into face masks and vaccinations. So this is some of the early findings from that section. We're interested in what types of organisation or advice would try to would have a persuasive effect on people. So we have a question about whether it's the law, whether it became the law, whether you would follow the advice to wear a face mask, which is the second one down, whether that advice came from the government or whether that advice came from an international organisation, or whether it was really the effect of seeing a lot of other people around you doing it that would make you more willing to take part in that. And to ask that kind of question across 29 countries with all the cultural differences that are involved in that is an important thing to do. We're interested in the kind of effects that it can have on people. So 39% of users of face masks say that they've found it difficult to communicate, which is obviously a pretty high proportion of people there. And 29% say they have sort of general discomfort from doing so. But it is interesting to note that of those people who haven't been using face masks, 50% of them think they would actually have some degree of discomfort. On the vaccination side, there's a real concern from the WHO and many others that people are actually missing out on vaccinations and indeed, all other kind of health-related, non-COVID-19 health-related issues. In the UK, at least, we found when we ran this question just in the last week, we found about 3% of those who responded reported that someone in their household had missed a vaccination due to COVID-19, and often that's children, of course, with their programme of vaccinations. I think that brings me to the end of the selected highlights from the behavioural study.
Fantastic. Thank you very much, Gavin. That's really interesting, especially that teaser at the end there regarding face masks and would or would not encourage people to wear one. Right, on to the science. And I'm delighted to introduce Sarah P. Jones from the Global Institute of Health Innovation at Imperial College London. She's a doctoral researcher under David Nabarro, one of 6 COVID-19 special envoys to the World Health Organization. But she's not just a researcher and scientist, she has also been a global marketeer. And one of the most prestigious roles from her CV being the former global marketing director of De Beers, the LVMH luxury brand. So Sarah's going to take us through some of the science and just a reminder that we are asking for your questions, so please do use the chat function, whether they be about this data, whether they be about YouGov's general work, but or about the science as you're about to hear. So please do use that, and I'll pass you over to Sarah.
Will, thank you so much. It's a pleasure to join everyone. Imperial College London has been working closely with YouGov offices in 29 countries since March to get data and insights into the hands of researchers around the world who are urgently in need of real-time data. It would be difficult to imagine a more pressing time for data companies to offer data for the public good. I know I can speak for all of the scientists and researchers involved in the Imperial College London YouGov collaboration when I say thank you for being very generous with your data. On the screen, on the next slide, Will, you can see where the data researchers are using this data. It's available for all of the public, including all of you on this call. And if YouGov clients have questions about how to use the data that we're going to discuss today, if you have any questions at all about the models behind what we'll look at today, please don't hesitate to contact info@yougov.com and they will answer your questions or put you in touch with me. There are 4 main activities that we're working on together to support the research community, and we're providing policy and guidance to countries around the world. The first is coviddatahub.com. This is a publicly available dashboard. It's created by the Imperial College London YouGov collaboration. It's updated daily with new data, including the Johns Hopkins case and death data. We track trends over time in consumer health behavior related to COVID, with the aim of developing timely research bulletins, which we share with our research network. This data is available also on the YouGov GitHub page. We are collaborating with and informing other researchers. I'm contacted every week by other researchers who are using this data for various scientific projects, including researchers at Harvard, Oxford, Columbia, Edinburgh, the WHO, the Bank of England, LSE. Our close collaboration network of researchers includes epidemiologists and public health experts here at Imperial, also behavioral scientists and behavior risk planners at the leading public health organizations, economic collaborators such as Jeff Sachs, and well-being expert John Hallowell and the entire World Happiness Report team. But one of the most important factors to consider when looking at this behavioral data is the policy context in which consumers are operating. And Will, if you could move to the next slide. Thank you. Researchers such as ourselves are gathering policy data about how stringent restrictions are from a source provided by Oxford University as a free service to the public. You can see here a visualization over time about how restrictions on public gathering have taken over the world very quickly. This type of data is available in numeric format from Oxford University, and it is also resident on the ICL YouGov dashboard, coviddatahub.com. Now, why is this context so important for researchers, and why do you also need to track this data? In order to control unchecked virus transmission and virus reproduction rates, it's essential that the public performs the kinds of public policy measures, such as those recommended by the WHO, at the right time. When researching why and how health behaviors are occurring, it's important to consider the context in which they're happening. This helps researchers to unpack differences in behavior and attitudes. One useful way of doing this is comparing behavior in countries operating under higher stringency policies and those with lower stringency policies. For example, among the higher stringency countries, 69% of respondents reported avoiding going to shops always or frequently versus 51% in lower stringency countries. We track this to understand more about how people's collective behavior is changing over time in relation to policy, with the hopes that researchers can understand better how this affects transmission rates. However, I bring this up here because these types of behaviors have clear implications for brick and mortar shopping. By tracking policy changes along with behavioral data and local footfall data, you should have a better idea of when people will return to the high street to shop and in what numbers. Now, we'll have our first deep dive on the mask wearing behaviors finished in about a week or two's time. And I would encourage all of you to come back to coviddatahub.com or the GitHub page run by YouGov to download this data for 29 countries for free. At present, for example, we're looking at the differences between higher and lower stringency countries on wearing a mask in public. Higher stringency countries are wearing masks in public always or frequently 73% of the time versus 49% for lower stringency countries. Now, this may have implications for virus transmission rates. An important consideration in life during and after COVID is life satisfaction. We will have much more to say about this in the coming weeks, but we will be announcing soon that the global leaders in this research are joining the Imperial College YouGov collaboration. The team behind the World Happiness Report, including John Hallowell, Jeff Sachs, Richard Layard, and Jan-Emmanuel Deneuve. The World Happiness Report is a report published annually by the UN Sustainable Development Solutions Network. Life satisfaction provides a very powerful umbrella measure of the quality of people's lives. In the annual World Happiness Reports, differences among countries and over time in these evaluations are explained by good health, income, and 4 measures of the quality of social context: trust, generosity, having someone to count on, and freedom to make key life decisions. All of these elements are changing under COVID-19, often in ways never experienced before. The YouGov life satisfaction data collected regularly as the pandemic evolves in each survey country provide a valuable barometer of life under COVID-19, reflecting each country's institutions and policies. Along with life satisfaction, good health, income, and quality of the social context, we are at the start of a long research dive on depression and anxiety around the world. Early figures indicate that there may be large differences in the global populations, with worryingly high levels of what we might call moderate or severe symptoms as measured by the PHQ, seen here in the week of April 27th. However, and we will have more from this from our research collaborators in the coming months, there are very worryingly high levels in Italy, Spain, and Brazil, with around a third of the population reporting these high levels. Germany, in comparison, is quite low, and the US is in the middle of the pack, and the UK is more or less at the middle of this pack. But we would not be surprised to see this grow if the economic damage widens. Most troublingly is I personally have been measuring the adult British population on the PHQ-4 since 2017, and the highest this measure has ever gone is 21% in the past. If this trend continues, this is definitely not good news in the UK. It's Mental Health Awareness Week here in the UK. So I'm going to stop and take this opportunity to remind everyone on this call that there is no health without mental health. And if you are one of the many people who does not have a mental health awareness program through your employer or mental health services, you should contact me to recommend programs or complimentary free resources for you, including a study at Imperial, which offers free mental health awareness training. Please feel free to contact me about any of those mental health questions. Now, along with this, there is behavioral data, not just symptoms. Now, for those of you who are familiar with the now ubiquitous R number, this is going to make sense. Let me briefly explain the R number. First of all, it is an estimate. That's very important to recognize. One easy way to think of the R, the reproduction rate, is the number of people a single person can expect to transmit the virus to. If a region has an overall R rate of less than 1, then a virus is reproducing at a rate which will not grow exponentially in the population. However, if the R rate rises above 1, then each person in that region is on average transmitting the virus to more than one person, and this is a rate which will grow exponentially in a population. The R number, unfortunately, has to be estimated retrospectively because there is a time lag between infection, symptoms, and deaths. At the bottom, you will see the ways in which the R number has the chance to increase in the community. It's these behaviors that we are tracking with the ICL YouGov dataset. So let's focus in on the lower right of this chart. This is crucial. Who is a case? What is a case? Without widespread testing, we cannot know who is a case and who is not. Most cases are probably asymptomatic without symptoms. It's essential that each country take responsibility to isolate each case and look after them and their household until all members of the household are healthy and clear of the virus. Their contacts need to be traced and notified, usually using humans, not apps. And it is at this stage, setting up this type of system, that many countries, including the UK, are in at the moment. Now let's move to exit strategy on the health side for a moment. There are 4 exit strategy principles from a recent WHO communication: infection status, community acceptance, public health capacity, and health system spare capacity. Infection status and how it informs lockdowns and exit strategy. There are 4 things to watch here in order to predict what will happen next. The first is the rate of infection. This is the incidence rate. For example, how many new cases. The second is the doubling rate. That is the number of days needed to double the number of affected people. Third is the case contacts. This relates to the R rates, where we want to see these less than 1. And currently in the UK, this number is less than 1 and has been for several weeks. And the testing positivity is less than 5%, although this is very difficult to compare country by country, while some are testing only health workers and some are testing more broadly in the community. Community engagement is the next principle, and this is very important. Without proper communication and engagement with citizens and local decision makers, willingness of the public, and especially that of corporations or public services, to comply with these measures is unlikely. That includes no medium to large gatherings, limiting movement of people between cities, shielding people over 70, and even schools gradually reopening in phases, and students learning to comply with difficult social distancing measures. The very unfortunate message that is also in this communication from the WHO is there may be consequences for companies and individuals as a result of the lack of coordinated preparedness that almost all countries have faced as a result of COVID. Increases in taxes and possibly reductions in income and benefits. Now, are people complying with health directives? Will they continue to do so if restrictions continue? There are many ways of attempting to answer this question, and one place to start is by looking at some of the evidence about what is known to drive people's health behaviors. The health belief model of health behavior, pictured here, suggests that key drivers of a positive health behavior, such as stay at home, include a person's perception about the severity of the illness, a person's perception of their susceptibility to the illness, what they perceive as the barriers and benefits of staying home. Factors also include a person's general health motivations. It also includes the cues from their body or their environment that they receive about the illness. This could be symptoms, such as a dry cough or loss of taste or smell. This could be public health campaigns, such as Stay Alert. And it could be other cues, such as ambulance sirens or clapping for carers even. But there's growing sentiment among those looking at the data that trust in health advice and trust in the government are actually key to making these actions stick, such as stay at home. Now, important for all of your businesses, of course, is the health and welfare of your employees and your customers. And in the past, it's very unlikely that you were in need of forecasting while taking into account uncertainties that have not previously been relevant in the realm of brands, such as policy and consumer health, supplier health. Some of these constraints are out of your hands. Stores are shut, people are home, people are nervous, many are falling ill. It's very important to keep an eye on the policy in your region, as well as the national policy, and to forecast keeping an eye on the 4 principles that I mentioned: the infection rate, the doubling rate, the case contacts, and the R rate. Next, I want to spend just a few minutes looking at models of how government and even brands can plan their actions around consumer behavior and attitude change. What we're looking at here is the behavior change wheel by renowned world leader in behavior change related to health, Susan Michie. On the outside in purple, you have the policy measures that surround people in their countries. Fiscal measures, such as stimulus packages, communication, such as public health campaigns. Now, it's very unusual for countries to use all these policies in lockstep together. The purple ring is the context in which all are operating at the moment. At the heart of these circles is the individual, that's the green. We'll get to how you go from purple to green in a moment, but let's look at the green, the individual. Where does consumer behavior originate? Every individual's behavior starts with their perceptions of 3 things: their capability, their motivation, their opportunity. Individuals' capability is both psychological, their perception of what they're capable of, and their physical capability. For example, are people physically able to get into a store to shop, or are they confined to their homes? If shops are open, do they perceive they can get in and out safely? An individual's sense of opportunity is also driven by their sense of what they can manage physically, and that depends to a great extent also on what they perceive as socially acceptable. Their motivation is driven by both unconscious thoughts, automatic reflexes and thinking. For example, are people withdrawing from those around them who sneeze or cough without even thinking about it? Or in a happier setting, is it walking by a Cinnabon counter in a mall and your stomach rumbling without you thinking about it? Motivation is also governed by active thinking, such as, it's hot today, I don't have a sun hat, I think I'll pop out to get one. Or, I want to use public transport, but I don't have a glove or a mask, and so maybe I will stay home and reconsider tomorrow. But it's here in the orange and pink rings that both public health bodies and brands need to think about to shape the green parts, the individual. The orange and pink rings are your toolbox. You can combine them in any way except coercion, which is usually not ethical. For example, you can use persuasion to promote optimism. That influences capability, motivation, and opportunity. I'll skip over for now what the public health bodies are doing and give you my thoughts on how brands need to plan for economic recovery in terms of customers. For example, some brands may use incentivization in pink, such as discounting or launching new ranges, to increase intentions in orange. The idea, of course, is to influence the green, the individuals, their capability, their motivation, their opportunity. Many retailers will be using restructuring the environment in stores with tape for social distancing or different visual merchandising. That's in the pink ring. They do that to affect the orange, which is to shape the beliefs about consequences of shopping in person. Or perhaps you're offering curbside pickup with ordering via e-commerce. Both of these ultimately have influence on the green, the individuals, and their sense of capability, motivation, and opportunity. I would encourage all brands to lean on this model or models like these to keep the fluctuations of government policy in mind when you're planning your activities. Be prepared for what's coming next and what that means for your physical presence, and get future plans from retailers. Make sure your messaging is clearly targeting one or more of the green areas, and make sure you're clear about which methods and mechanisms, which pink and orange you're using, and explore the alternatives, both for maximizing impact, but also for reputational risk mitigation. And again, if you have questions about this model, please don't hesitate to get in touch by emailing info@yougov.com. And with that, Will, I'll hand it back to you.
Fantastic, Sarah. Thank you so much. It's absolutely fascinating. All of that from that nudge behaviour and following the models to understanding R. Right, we've come to your portion of this webinar. So if you do have any questions, please do put them down in the chat function, and we'll try and get through as many as we possibly can. I'll give you a minute or so to talk about that, or though I can see we have one question in already, while I talk about what's coming next. So we are continuing our webinar series. The ones coming up next week and the week after that are looking at YouGov's connected data asset. So in particular, we're looking at brand index and profiles. What we're going to be looking at is what are the audience shifts that have happened? What are the most potentially valuable audiences for brands to chase, and what are the potential audience pitfalls? We're also going to look at brand performance over the course of the pandemic. Some in particular who've got it very right. If we take some UK examples, it might be someone like Brewdog, who turns their brewing infrastructure to manufacturing hand sanitizer. Whereas some of the other examples of brands who didn't necessarily get their position or their messaging right at the very start, and as a result, the performance of the brand has dropped. So that's what's coming next. If you do have any questions immediately following this webinar that you wish you'd put to us or would like to put to us in private, then please use info@yougov.com. It's a global mailbox, and so we'll get back to you as soon as possible. I mentioned also at the top of this presentation that I would put the links up to our open data sources. So for the GitHub address, so you can find all of the data that Gavin went through across all 29 markets that we're tracking at. It is available to download for free at respondent level at github.com. So please do go there and download, analyze that data to your heart's content. If analyzing row-level data isn't necessarily your thing, then Imperial College has created coviddatahub.com. It's dashboards powered by Tableau. At the moment, what's on there is question-by-question analysis to give you market comparisons, but that will soon be evolving, as I understand it, into more of a time series data set. Of course, you're also very welcome to visit YouGov's website. We have pages dedicated to our public data offer so that you can see all 27 markets where we're tracking in the consumer world. And those charts are interactive either by region or by particular market. Right, over to your questions. And just let me bring these up. Gavin, I think it's a nice, easy one to start with for you. Is Ireland covered in our studies?
No, sorry.
Nice and short and sharp. Sarah, I'll come to you. There's one that's come in regarding, given that it's Mental Health Week, I think particularly pertinent. So the question is, can we unpack a little bit more about what is PHQ-4 and some of the scores around it? And as a follow-up to that, are those scores of concern and why?
Certainly. The PHQ-4 is a very well-validated screener. This is something that's been used for 2 decades in research, really, to assess anxiety and depression. Anxiety is the most common mental health condition that there is. It frequently results in less what we call disability-adjusted life years in policy, which means that it's more frequent, but it has less impact than, for example, depression. Nonetheless, anxiety and depression are the most common medical complaints in any GP surgery in the United Kingdom, and they have been for some time before the pandemic. These measures we use because there are 4 questions. It's ultra brief, that is the actual technical name for this ultra brief tool. But it has very good sensitivity and specificity, which means it's very, very good at detecting positives, and it's pretty good at detecting false negatives. The reason why it's important to us is we know that both life satisfaction and mental health are taking a hit during the pandemic. We are looking as quickly as possible to figure out which populations are most at risk and what kind of interventions can be used in order to reach them. We're particularly concerned about older people who may have to shelter in place for quite some time. And we're also concerned about people who have had mental health problems in the past, in particular. And what was your second question, Will?
Sure. The follow-up to that is if these levels of concern, what is the major concern? Is it impact on consumer spending? Is it overwhelming the NHS? What are the other underlying problems or issues that are going to surface as a result of these higher scores?
Well, unfortunately, and there's no causal model here, it's really a correlation model, that mental health and physical health are very highly correlated. It is not uncommon to find people who have chronic health conditions to have a much higher risk of mental health conditions. What we would probably expect is that this is going to be on the increase for people who have chronic health conditions who have been outside of the health system now at home and not going to hospitals for regular treatment. So we would expect the incidence to rise, most likely in people with chronic health problems. Extreme mental health problems also can take people out of the workforce for some time. The vast majority of people with mental health problems do work and do stay in work. However, it is certainly recommended that if you feel as though work is overwhelming for you, that you do request time off from an employer and you do take advantage of the ability to do that. I would not be surprised to see more people doing that over the next 6 to 8 months. And I've frankly been encouraged by the number of companies who have started talking more about mental health in the past year or two. Recognizing it is very important to allow their employees time off when they need it, e.g. on the weekends, and not being pinged with emails constantly, as well as disconnecting while on holiday.
Great, thank you very much, Sarah. That's really interesting. Gavin, again, sort of more of a technical question coming to you. I think is the open data going to be available at an LSOA or MSOA level, or any other kind of regional or localized level?
So within the UK, well, within every country, that we have included a regional variable. As to whether we would go any lower than that, we could certainly think about. Well, I suppose to give you the straight answer is we can do it because we have it. Well, I suppose we'd have to think through the implications of that. We are, as Will mentioned, providing this data through an open source for the first time ever in YouGov's history. And we did need, of course, to go through the processes to make sure that what we were doing would result in the data being remaining anonymous. So in order for us to add the LSOA to that data, we would have to go through that process again with our data protection team to gain sign-off for that. So, I mean, it'd be very interesting if we could do it, but maybe I'll make a note of it and explore that with our data protection officer. The danger, of course, being that you add something very localized, such as that, geographically, and then that in conjunction with everything else that we're telling about the individual respondent raises the risk at which the individual could be potentially identified. So if there is any risk of that, then we won't be able to do it. But I can ask the question.
Fantastic, thank you very much, Gavin. Sarah, coming back to you and thinking about the Susan Michie wheel. Mm-hmm. And the question is, what elements would you recommend for a travel brand at this time to begin nudging customers to travel again, perhaps sooner than expected?
That's a great question. It's relevant for everyone who loves to travel, including myself. I think the first, and I'm not saying this because we're on a YouGov call, the first thing I would say is that you really want to ask your customers what is standing in their way besides the obvious policy restrictions, and getting a real hold on what it is that they miss most about traveling, and translating that into some of the motivations and the opportunities. Clearly some markets will open up quicker than others, so keeping an eye on policy, and that creates the opportunity. In that respect, I think using social comparisons to others who are doing it and doing it safely. And I think doing some deep dives into consumers' motivations to travel, for example, reconnecting with friends or reconnecting with family that they haven't seen, and finding out what it is that they would first like to go and do. And perhaps for many people that's, I would really like to go on a holiday by myself without the children and family that I've been locked in a house with for 2 months. That's also possible. But I would really recommend looking at what the consumers miss most and trying to activate that using the social, certainly incentivization will be very easy to use, but using social comparisons and a bit of education, I think, as well, about what is happening in hotels, for example, and in airlines, to increase people's safety. I think that consumers, and this is not based on any scientific evidence, I think that when consumers see people cleaning and with masks and with gloves and paying attention to social distancing rules, they will be more likely to engage in public spaces and in hospitality. And I hope to see that soon. I do think it's important for companies that are in hospitality and tourism especially to work together and publish case studies through their professional associations about best practices. This is a time when companies, retailers, hospitality, leisure, they need to work together, and they need to work in lockstep to make sure that the messages get out and make sure that best practices are measured and shared.
Fantastic, Sarah. Thank you very much indeed. We're going to wrap it up there. and wish everyone a fantastic bank holiday weekend. First of all, thanks to Gavin. Thank you very much to Sarah Jones from Imperial College London, and thank you very much to you, our audience, for listening and tuning in. Just to repeat, if you do have any further questions, info@yougov.com, and please do stay tuned to all of our marketing messages that will be coming out that will give you an update on all of our data sources. But from all of us at YouGov and Imperial College London, I hope you have a very good afternoon.